Hi, my name is Kai. I'm going to be your nurse today. How are you? Good. Can I get your name and date of birth? Okay. All right, perfect. Okay, so I looked at the doctor's orders and it looks like you need an indwelling Foley catheter. Is that okay with you? Yes, okay. So we're gonna get started. I will be showing your private parts. So if you feel uncomfortable at any point, please let me know and I'll try to make sure you're as comfortable as possible. I'm gonna move the bed up a little bit for me to do at working level. And also before the Foley catheter is inserted, I did make sure that the peri-care was done. I will also make sure that the patient is not having any issues with aspirations and that he's okay at a supine level and he's not going to struggle with breathing or anything while this process is happening. Perfect. Feels still pretty comfortable. Okay. Now I'm going to assist the patient in removing the blanket, his gown, getting the area ready for his Foley catheter insertion. I'm also going to take the things that I'm going to use later, put them aside so they're not in the sterile area. I'm also going to take the biohazard bag, put it next to the patient so anything that we're using can be disposed of in the proper area. All right, I'm going to put the biohazard bag next to you if that's okay. I'm also going to be exposing some of your private area. Just going to put on some gloves just in case there's anything that's soiled or anything that I don't want to touch with my hands, and we're exposing the private area. So I'm going to pull the blanket down to about the knees. Okay, now I'm going to expose your private area. Also, I'm going to make sure, since this is a female, that their legs are in frog position, just to help me get some easy access. And since the patient can't move their legs, I'm going to help assist him. Going to move your legs into a frog position. Perfect. Okay, and now that the legs are in frog position, I'm going to start getting ready for inserting the Foley catheter. So I'm going to sanitize, because now I'm going to put on my sterile gloves. And before I put on my sterile gloves, I'm going to start with opening my packaging. I'm going to move the bed up a little bit, just so it's a little higher, since I touched the bed. Sanitize again. So when I'm opening the packaging, I want to make sure that I'm not opening it where everything is falling out. Also going to be making sure that I have the correct Foley catheter for the patient. Now I'm going to take my sterile gloves and put them on. Now I'm going to start, but also staying in the sterile area. And I kind of touched the side of this curtain, so I probably would change gloves just because I want to make sure I'm as sterile as possible. Also going to take this. Everything inside of this packaging is sterile. As you can see, I have my sterile gloves outside of the packaging because there are sterile gloves in here, but I don't want to risk putting my hands into a sterile area. Staying within the 1-inch margin. So we're going to get these pads out. Sterile extra gloves, put them on the side. Pad. Then there's a cup inside that would use for a specimen if we needed the specimen, but the doctor did not order it, so I'll use it. Gonna make sure that I put my cotton balls in the right area. We're only gonna need 3. So I'm gonna put 3 over here, put the others on the side. Also, we have our water for our catheter, put that on the side. Then we also have our lubricant. These gloves are big. Now I'm going to start with draping my patient. I'm going to open this up. I'm going to make sure that the shiny part is on the bottom. I'm going to also make sure that my hands are covered and that they're not going to be touching the patient. All right, I'm going to place this underneath your legs and your buttocks. And if I were to touch the patient's leg, I would, once again, change my gloves to make sure that the area is sterile and make sure that it's more straight under the patient. And they could probably help me by lifting up the coccyx in the bottom of their body. Okay, now I'm going to take the second draping, open it up, look for the shiny part, and I'll place this over the patient's genitalia. Make sure it's only exposing the area that I need. Then I'm going to start to prepare to get the catheter ready for placement. So first, I'm going to put my iodine on my cotton balls. Making sure I'm using all of it. I'm also going to get the catheter ready for, so when after I clean the patient, that everything is already ready to go. So I'm going to take the catheter tip out. I'm going to be taking off the blue part of it. Also going to be making sure that this stays sterile. I'm going to place this inside of the lubricant so that it's ready. I'm also going to take this and attach it, which is the water for the balloon that goes inside of the urethra. And I also want to make sure that I hear a click. Perfect. So everything is prepared for when I get ready to insert the catheter. So now, once I use this hand will be contaminated and I cannot use it anymore for the procedure, for the Foley catheter insertion. I'm also going to make sure that I'm spreading apart the labia. The proper manner, making sure that I'm looking at the anatomical markings for each patient. Each patient is different, so you want to make sure you can find the area where you believe your catheter will go. So you want to be for certain. So I'm going to start with cleaning. Start with our first cotton ball. I want to start away from me. Going down. And then, as you can tell, my finger kind of touched, so I would probably need to start over again and wipe this area since the labia closed. And then I would go down the middle. And then I wouldn't wipe back, I would just go straight down. Okay, so now that this part is done, I'm going to get ready to insert my catheter. So I'm going to grab, make sure this stays sterile. Put the box in the center. I'm also going to make sure, as you can see, it's kind of a little bit more difficult since it's a mannequin, making sure this area stays open and exposed. I'm also going to make sure when I'm doing this that I'm telling the patient to take a deep breath. And if they feel uncomfortable, please let me know. So if you feel uncomfortable at any point, let me know while I'm inserting this, and then we'll kind of assess from there. So as I'm putting the catheter in, I'm gonna go to 3 to 4 inches. Then I start seeing urine return. And then once I feel that I'm in and I see urine return, I'm just gonna go 1 more inch in. Perfect. And now I'm going to use this hand to hold the catheter. So now I'm going to bring the catheter out of the box. And then I'm going to start with filling the balloon. Perfect. And now I'll pull on it a little bit, make sure it's secure. Then I will remove this. And then before, just to make sure I'm not adding any air bubbles, I should draw back and then push forward to make sure there's no air bubbles. And now that the catheter is inserted, I will take off my sterile gloves. And then I will sanitize again. So now I will put my gloves on and start removing the draping, and then I will attach the bag to the leg as well as attach it to the bed. Doing okay? Did great. So I'll now remove the draping. Now I will put the leg secure. Don't know the exact word for it right now, but the leg lock for the catheter piece. Also going to move the legs back for the patient. Place it on the side of the leg. So this is going to be taped to your leg. It's just to make sure that the catheter is secure. It's not going anywhere on us. And this actually does have adhesive on it, but for simulation purposes, I'm just going to not put the adhesive on so someone else could use it. I'm going to take this piece, making sure that this red piece is on there and this top piece is on there. Put this inside. Secure it. Then I'm going to take the bag. Open it up. Also want to make sure that it's in a circular motion, and it's not like completely straight, so the urine has some way to go. I'm going to attach this to the bed. Take all my biohazard stuff out. Okay, now that I know that the catheter is complete and placed in the correct area, I'm gonna put the blanket over him and make sure this is secure. All right, so that completes your Indwelling Foley Catheter. Like I said earlier, if you have any questions or anything, or if anything feels uncomfortable, please let me know. We'll also come back and check in about 15-30 minutes to make sure everything's looking all right for you. Is there anything else I could do for you today? No? Okay, perfect. Well, I'm going to sit you back up, and I'm going to put your call light right here. If you need anything, please let us know. And I'll sit your head up. All right, and then that completes my Indwelling Foley Catheter insertion.